Welcome back guys. Now in this video let's discuss about thyroid hormone biosynthesis. Okay, we have already discussed about the growth hormone and also we have seen the important functions of the growth hormone. Now in this video, yes, we are going to discuss about thyroid hormones. Now first of all, let me show you the thyroid gland. Okay, in a simple way, let's see about the thyroid gland. Now this thyroid gland, okay, which is present on the anterior surface of the trachea in the neck, okay, it's present somewhere over here. Now this thyroid gland, okay, it's bilobated, which is connected with the help of this bridge-like structure. Both the lobes of the thyroid gland are connected by the isthmus. Okay, well and good. Point is, see, this thyroid gland have two different types of cells. The first type of cells, okay, let me show you here in the green color. Now these cells which I am showing you, okay, they are arranged like this in the concentric structure. Now these cells, they are called as the follicular cells. Okay, all these are the cells with the nucleus. Now these are called as the follicular cells. Now these follicular cells, they are the ones which produce the T3T4. Okay, the follicular cells, they will produce T3T4, and the T3T4 is going to be stored in the central part. Okay, it's going to be stored in the central part, which is called as the colloid. So T3T4 are produced by the follicular cells of thyroid gland. After this, there are also other cells which are called as the parafollicular cells. Para means side. So these cells are surrounding the parafollicular cells which are present, okay, in the interstitial region. Now these cells are called as the parafollicular cells. Okay, these are parafollicular cells. Now these parafollicular cells, okay, they are producing calcitonin. Okay, they are producing calcitonin. So follicular cells, so these follicular cells, they are producing T3T4. The T3T4 are going to be stored in the colloid, in the centralmost region. And in that colloid, the T3T4, the thyroid hormones can be stored up to almost 3 to 4 months. And the parafollicular cells, okay, what they are producing? They are producing a hormone called as calcitonin. And what is the important function of this calcitonin? Calcitonin is going to decrease the blood calcium levels. Okay, calcitonin decreases blood calcium levels. Okay, that's the important point which you need to know. Now, let's take up the follicular cells. These are the follicular cells. Okay, clearly it was shown the follicular cells with the central region. Here the central region was shown with the light blue color. Again, that region is called as the colloid. Now I am showing you one follicular cell. I am taking one follicular cell with the little amount of colloid. Okay, let's take from here. This is the one follicular cell with little amount of colloid I am taking. So here you can clearly see this is the follicular cell and this blue color region is the colloid. Now let's start our topic, that how thyroid hormones are actually produced. See, let's start from this, something like, imagine that there is this one person who have taken, okay, a seafood, or imagine that me, I have taken a seafood, like in a fish. Now we all know that the seafoods are rich in iodine. Okay, the seafoods are rich in iodine. Now this iodine, now the seafood is going to be digested in the stomach, and in the stomach these iodides are released, and these iodides are going to be absorbed into the blood. Now see here, these iodides, now they are present in the blood. Now where it should go? It should enter into the follicular cells. For the production of T3T4, we need this iodine. Okay, we need this iodide ion. So this iodide ion, say I minus, okay, this iodide ion need to enter into the follicular cells. Okay, so now this iodide ion is coming like this. It comes like this, comes like this, comes like this, and see here, there is one important transporter present. What is this transporter? This is sodium iodide sympater. Okay, this is sodium iodide sympater. So with the help of sodium ions, yeah, sodium ions are going into the cell. Okay, sodium ions are more outside, we know. Sodium ion concentration in the cell is less. So sodium is going to move from high concentration to low concentration. So along with the sodium, this iodides also enters into the cell. Okay, iodides also enters into the cell. So this is an example of co-transport. So sodium iodide sympater, this is the first step. So what exactly is the first step? Taking up the iodide ion, iodide. Okay, so this is one part of the story. Okay, imagine this is our hero. Our hero have entered into a cell. Now let's talk about the other part. Okay, about this lady. See, now these follicular cells, okay, see, this is the second thing. So these follicular cells are producing an important protein which is called as a thyroglobulin. This is the rough endoplasmic reticulum. Okay, let's take it. This is the rough endoplasmic reticulum. In the rough endoplasmic reticulum, see, we all know rough endoplasmic reticulum is nothing but the endoplasmic reticulum with the ribosomes, where protein synthesis will happen. Now here protein synthesis is happening. Now which protein? It's a thyroglobulin. So thyroglobulin is getting produced. So what is that protein which is produced from the follicular cells? It's a thyroglobulin. Now see, this thyroglobulin is packed into a vesicle. Okay, it's packed into a vesicle, and that thyroglobulin is also going to enter into the colloid. Okay, so first thyroglobulin enters into the colloid. Okay, now important point about this thyroglobulin, please appreciate. See, this is a thyroglobulin, right? This is a protein, thyroglobulin. Now please appreciate this thyroglobulin, it have many tyrosine residue. Tyrosine is an amino acid. Okay, first of all, thyroglobulin itself is a protein. Now we all know proteins are made up of amino acids. Which amino acids? See, the more tyrosine residues. Okay, more tyrosine residues are present on the thyroglobulin. Okay, so thyroglobulin is a protein with large amount of tyrosine residues, tyrosine amino acid residues. So okay, now we have sent the thyroglobulin, and also we have taken the iodide ion into the cell. This green color thing is the iodide ion, see, I minus. Okay, now what we need to do? See, we need to meet this, okay, hero. Okay, our hero have to go and meet with the heroine. Okay, the heroine is nothing but here is the thyroglobulin. So how actually they meet? See, first of all, this iodide ion, it's having a negativity, right? So it's not good to have negativity. Okay, even our hero is having little amount of negativity, which is not good. So what we need to do first is we have to remove that negativity. Okay, we have to remove the negativity. So that process is called as oxidation. Okay, now how that oxidation will happen, we'll discuss now. See, this iodide ion, first it will enter into the colloid. The first step is now, yeah, this iodide ion, it have to be, see, it is now coming like this. Now it have to enter into the colloid first. Okay, in order to meet our heroine, now this iodide ion have to also come into the colloid. Now the transporter which is helping, okay, this transporter, the transporter which is helping in the movement of iodide ion from the follicular cells into the colloid, the name of the transporter is called as a pendrin. Okay, now pendrin. Now okay, well and good. Now see, this iodide ion, we need to take out this negative charge. The process is called as oxidation. Who is going to do that job for us? There is an enzyme called as thyroid peroxidase, TPO. Okay, this molecule, please look at this molecule. Okay, so this molecule, see, okay, this molecule, what it is doing, it is taking up the iodide. Okay, it's taking up the iodide, and at the end of the day, thyroid peroxidase, TPO, the thyroid peroxidase, shortly called as a TPO. Now this thyroid peroxidase, what it is doing, it is converting the I minus into I2. So negativity is lost. This process is called as oxidation. So this step, the transformation of I minus molecule into the I2 with the help of thyroid peroxidase in the colloid. This is called as oxidation of iodine. Okay, now our hero is ready. Okay, he is well groomed. Okay, there is no negativity. He is absolutely well groomed. Now what we need to do? Now this iodide, it have to go and meet with our heroine, the thyroglobulin. So say this I2, it is going like this, and it is coming and meeting the thyroglobulin. Who is helping that? Okay, who is helping? So same molecule, see, the thyroid peroxidase, same thyroid peroxidase is taking the iodine, and what is doing? This iodine is being incorporated onto the tyrosyl residues. See, here is a tyrosyl residue. Okay, this is a tyrosyl residue. All this, like all these are the tyrosyl residues. Now onto the tyrosyl residue, this iodine is going and getting bonded there. Okay, our hero is now meeting with the heroine. So this process is called as organification of iodine. See, in the name itself, it's very clear, right? Organification of iodine. Why? Because see, this protein, okay, thyroglobulin, it's a protein, organic thing. Our iodide, it's inorganic, right? Inorganic chemistry, iodides, all this thing. So iodide, that is the iodide. First, what we have done, iodide is converted into iodine. Oxidation is completed. Now this iodine, okay, iodine, now it have to get incorporated with a protein. This is called as organification of iodine. Okay, so organification is also done with the help of an enzyme called as same thyroid peroxidase. It acts like a mediator, right? Okay, it acts like a mediator. Now, okay, well and good. Now, oxidation completed, organification is also completed. Now, what should happen is, see, for example, now after this organification, okay, after organification, what we are left with? Let's discuss. We are left with molecules called as monoiodotyrosine. Okay, monoiodotyrosine. Sir, what exactly is this monoiodotyrosine? See here. Now, this is a thyroglobulin molecule. This is a thyroglobulin molecule. Now, in this thyroglobulin molecule, see, here in this tyrosine, okay, on this tyrosyl residue, okay, on this tyrosyl residue, there is only one iodine present, Okay, if onto a tyrosyl residue, if only one iodine is getting organified, means then it is called as monoiodotyrosine. So what is monoiodotyrosine? Simple, man. See, we all know that there is this protein called as a thyroglobulin protein. Now on this thyroglobulin protein, okay, let me show you here. It will be much more easy for you. See, this is a thyroglobulin protein. Now on the thyroglobulin protein, we all know which residues are there? Tyrosine residues are there. All these are the tyrosine residues. Okay, all these are the tyrosine residues. Now during organification process, what happens? During organification process, let's take with the green color, the iodine. Okay, the iodine. Now iodine is coming and sitting on the tyrosyl residues. This is organification. Now here, see this molecule, okay, this is called as a monoiodotyrosine. See, mono means one, iodo means one iodine is getting onto the tyrosine. So monoiodotyrosine. Now see, on this tyrosine residue, okay, now two iodines are coming and sitting. Now this is called as, let me show you in this way. So two iodines are coming and sitting. This is called as diiodotyrosine. So monoiodotyrosine is there, diiodotyrosine is there. Now here also, now you should tell me what is this. Now here iodine is coming and sitting. Now this is also diiodotyrosine. Now here this is monoiodotyrosine. So based on the number of iodines getting organified onto the tyrosine, we are left with either monoiodotyrosine or diiodotyrosine. So oxidation completed, organification completed. Organification at the end of the day results in monoiodotyrosines as well as diiodotyrosines. Okay, monoiodotyrosines, diiodotyrosines. Now what happens is, see, now again this enzyme thyroid peroxidase, okay, this thyroid peroxidase, this enzyme, what it will do is, it will come and going to fuse this both. Okay, it's going to cleave here. Now what will happen? See, this is coupling, right? This monoiodotyrosine is now, it's fused with the diiodotyrosine. So now it is going to lead to the production of T3. So triiodotyrosine. Now for example, see, another molecule. This is also triiodotyrosine T3. Okay. Now for example, let's see here. This is DIT, diiodotyrosine. This is also diiodotyrosine. Now our thyroid peroxidase, see, now it is going to fuse one DIT with other DIT. See, this is DIT, no doubt, DIT. This is also DIT, diiodotyrosine. If you fuse, okay, if you fuse two diiodotyrosine molecules, then that will yield T4, tetraiodotyrosine or thyroxine, that T4 hormone. So this is how T3 and T4 are produced. Okay, so what is that important enzyme which is helping in this process? The important enzyme which is helping in all this biosynthesis of thyroid hormones is thyroid peroxidase. Okay, thyroid peroxidase helps in first oxidation, the conversion of I- to I2. Organification means the addition of the iodine onto the tyrosyl residues. And last reaction, see this reaction, this is called as the coupling reaction. Okay, coupling. So in coupling reaction, what happens? Monoiodotyrosine molecule, if it binds with diiodotyrosine, MIT plus DIT. See here, MIT. Okay, MIT means, see, only one iodine is there. Diiodotyrosine means DIT. DIT means, see, two iodines are there. Okay, see, if one DIT molecule fuses with the DIT, okay, diiodotyrosine, 2 plus 2, 4, it forms tetraiodotyrosine. If one MIT, monoiodotyrosine molecule, if it fuses with the DIT, it will yield T3, triiodotyrosine. Okay, so this is how the thyroid hormones are synthesized, and the important enzyme is thyroid peroxidase. Okay, now after this, let's discuss a few important points in this thyroid hormone biosynthesis. Okay, the first important MCQ which I want you to know is, say, this iodine trapping is happening, right? Okay, from the blood, iodide is entering into the follicular cells. This is called as iodide trapping. Now, this iodide trapping is happening with the help of which transporter? Sodium iodide symporter. Okay, this transporter, sodium iodide symporter, where the iodine molecules are entering along with the two sodium molecules. The question asked in the exam is, the sodium iodine symporters are present in? See, they are present, yes, they are present on the thyrocytes, they are present on the follicular cells. Okay, we have seen this is the basolateral side, right? This is the basolateral side. On the basolateral membrane, okay, on the basolateral membrane, yes, on the basolateral membrane, the sodium iodine symporters are present on the thyrocytes. Basolateral membrane of the thyrocytes facing the capillaries, yes, sodium iodine symporter is there. Not only on the thyrocytes on the salivary glands, gastric mucosa, placenta, ciliary body, choroid, okay, choroid plexus, mammary glands. In all this, okay, take a list. Okay, in all these areas, yes, sodium iodine supporters are there. Okay. Now, yeah, we have seen the steps also. Let's see steps one by one. We have already discussed this, but anyway, steps. What is the first step? We need to uptake the iodine. See, uptake of iodine, which is also called as iodine trapping. Now, iodine trapping is helping, it's occurring with the help of which transporter? See, iodine trapping occurs with the help of sodium iodide symporter. True. Now, the sodium iodide symporters can be blocked with the drugs like perchlorate and thiocyanate. We will discuss about this in a minute. But anyway, these thiocyanates and perchlorates, yes, they will block the sodium iodide symporter. Done. Now, what is the second? Okay, yes, hero is ready here. Okay, now our iodine is the hero. Now, who is the heroine? The heroine, yes, we have discussed that the rough endoplasmic reticulum of the thyrocytes are going to produce the molecule which is called as the thyroglobulin, the protein. Okay, yes, thyroglobulin is also produced. Second step also done. Now, what is the third step? Yes, we need to take out the negativity from our iodide molecule. That is oxidation of iodine. So, oxidation of iodine, see, iodine is transported out of the thyroid follicular cell with the help of iodine chloride antiporter called as a pendrin. I have explained to you. There is this one transporter called as a pendrin. Okay, this transporter is going to send the iodide molecules into the colloid, and in the colloid with the help of thyroid peroxidase, the I minus is going to be converted into I2. Okay, enzyme is thyroid peroxidase is important. Now, organification. What is the next step? Organification. In organification, what is happening? See, iodide incorporated onto tyrosyl residues of thyroglobulin. Okay, if this is thyroglobulin, now iodine molecule will come and bind to the tyrosine residues. If one iodine binds me, then it is called as a monoiodotyrosine. If two iodines bind, then it is called as a diiodotyrosine. So, organification is also completed. Now, after organification, we are left with coupling reaction. Coupling reaction, we are going to bind with the monoiodotyrosines with the diiodotyrosines, or we are going to bind with the, it's possible, yes, diiodotyrosine molecule can be bound with the diiodotyrosine molecule. Okay, leading to the formation of T4 and T3. T3 is triiodothyronine or triiodothyrosin. T4 is tetraiodothyrosin or thyroxine. Okay, this is how T3 and T4 are produced. See, now, let's discuss about some pharmacological link over here. See, the pharmacological link here is, see, the three important steps. Okay, the three important steps: oxidation, organification, coupling reaction. All of them are catalyzed with the help of an enzyme called as thyroid peroxidase. Okay, with the help of an enzyme called as thyroid peroxidase. Now, this thyroid peroxidase can be inhibited with the help of a drug called as propylthiouracil methimazole carbimazole. Okay, so propylthiouracil methimazole carbimazole are the drugs, okay, which are going to block the thyroid peroxidase. So, if you ask me why we need to block the thyroid peroxidase. For example, imagine that there is this one lady who is suffering with hyperthyroidism. Okay, there is this one lady who is having Graves' disease. Now she is having hyperthyroidism. Okay, now she is having hyperthyroidism. Now, what as a doctor you need to do? You need to decrease the amount of circulating T3, T4 hormones. Okay, you need to decrease the thyroid hormone synthesis. Now, we all know the important enzyme which is helping in the thyroid hormone synthesis is thyroid peroxidase. If you can inhibit thyroid peroxidase, oxidation is inhibited. So, automatically T3, T4 hormone production is decreased. So, propylthiouracil, methimazole, carbimazole are used in the treatment of hyperthyroidism. Why? Because these drugs inhibit thyroid peroxidase. Okay. Now, after that, let's discuss about a syndrome called as a Pendred syndrome. Okay, Pendred syndrome. Now, what is this Pendred syndrome? A little ENT link. This is a ENT link as well as a patholink. Now, Pendred syndrome is a condition where the pendrin, okay, this transporter is there, right? This transporter, pendrin transporter, this is mutated. If this is mutated, see, okay, if this is mutated, what happens? The iodide ions are not going to enter into the colloid. If the iodide ions are not going to enter into the colloid, means no production of T3, T4. So, by birth itself, this fellow or this baby is not having enough amount of iodine. So, the baby is not having the thyroid hormone. So, the baby is going into hypothyroidism. Okay, now this baby is suffering with hypothyroidism, congenital hypothyroidism, goiter is there. Okay, and even these transporters are very important. Okay, this chloride channel, this is what I see. Please concentrate, guys, here. See, this is iodine chloride antiporter. Okay, this is iodine chloride antiporter. Okay, so chloride is going to come into this. So, this is iodine chloride antiporter. Now, the chloride ions are very much important, especially in the ear. Okay, especially in the ear. See, because of the mutation of this chloride channel, also in the ear, the patient will be having sensorineural hearing loss. Okay, so in the Pendred syndrome, not only the hypothyroidism, not only the baby is going to have hypothyroidism, but also this baby is having sensorineural hearing loss or sensorineural deafness. Now, just tell me, by how many ways we can actually treat the hyperthyroidism. We can treat the hyperthyroidism by blocking this, okay, by blocking this transporter which is sodium iodine symporter. If you block the sodium iodine symporter, iodine is not going to enter into the cell. If there is no iodine, no T3, T4, okay, no oxidation, no organification, no coupling reaction, so automatically T3, T4 hormone production goes down. So drugs like thiocyanates and perchlorates, okay, thiocyanates and perchlorates can actually decrease the T3, T4 hormone synthesis. Okay, this is one way. What is the other way? You can actually inhibit the very important enzyme, that is the thyroid peroxidase. So thyroid peroxidase inhibition is done by propyl thiouracil, carbimazole, methimazole. Not only that, see, most of the thyroid hormone, look, the most important thyroid hormone, the abundant amount thyroid hormone which is produced is the thyroxine. Okay, so thyroxine is the most abundant thing. See, and wherever needed, see, in the body, wherever needed, the thyroxine T4 molecules are going to convert it into T3 molecules. Why? Because see, T4 is more in quantity, okay, the major thyroid hormone. But the active form is T3. T3 is the active form, potent form. It acts very rapidly and all the functions are done by T3 only. T3 is the potent form. Okay. So wherever needed, the T4 will be converted into T3 at the level of tissues. At the level of tissues, the T4 is going to convert it into T3. This is called as peripheral conversion with the help of enzyme 5'-deiodinase. There is an enzyme called as 5'-deiodinase in the tissues. This 5'-deiodinase is going to convert T4 into T3, inactive form into active form. Okay, so all the features, all the symptoms are also because of this T3. So if a patient is hyperthyroid, what you can do? You can actually inhibit this process, peripheral conversion. You can inhibit this peripheral conversion. So this peripheral conversion is inhibited by drugs like propyl thiouracil. Again, same. Propyl thiouracil inhibits the thyroid peroxidase also, as well as propyl thiouracil. P for, remember, P for peripheral conversion. It also inhibits the peripheral conversion, as well as drugs like labetalol. Okay, even labetalol, the beta blockers, can be used for the treatment of hyperthyroidism. Yes, why? Because labetalol inhibits the peripheral conversion. So these are some ways to treat hyperthyroidism. Okay. Now after this, let's see the differences between T3 and T4. Already we have discussed, but anyway, say T3 is active form, yes, but T4 is inactive. It's a less active form. Now see, T4 is a major fellow. Okay, major. So T4 is having long half-life. It is going to stay in the plasma for almost a week. Okay, once after release from the colloid, it is going to stay in the plasma for almost a week. But T3 is active and it is going to stay in the blood only for 1 day. Okay, in the plasma, its half-life is only 1 day. Okay, now who is more in quantity? The more in quantity is T4 and less in quantity is T3. See, the real store of a thyroid hormone is who? T3 or T4? It's the T4. Wherever needed, there T4 will be converted into T3. Okay. So who is the real store? It's the T4. So thyroid hormone store is T4. So T4 is the one which really gives the negative feedback. It's not the T3. Okay. So T4 gives the negative feedback. If you have enough T4 means yes, thyroid hormones are enough. And wherever needed, the T4 will be converted into T3. So T4 is the real store. So T4 gives the negative feedback. So T4 inhibits the TSH release, T4 inhibits the TRH release. Okay, so gives the negative feedback. Very important MCQ. Okay, T3 doesn't give any negative feedback. And who is more in the blood? So more in the blood is T4 and less in the blood is T3. Okay, so T4 will be having fast action. Yes, T3 will be having fast action and T4 will be having slow action. Why? Because T4 is inactive, right? Okay, inactive, so slow action will be there. T3 will be having fast action. Okay, now T3 in the blood. Okay, in the blood it's not available in the free form. Okay, even only little 1% will be available in free form. But most of the T3 and T4 both. Okay, see, if a hormone is in free form means it is biologically active. Okay, we don't want all the hormone need to be biologically active. Wherever needed, we only want in that place it need to be biologically active. So most of the T3 is bind with albumin. Okay, most of the T3 is bind with a plasma protein called as albumin, and most of the T4 is bound with a plasma protein called as globulin. So thyroid binding globulins. Okay, yes, I have already explained to you that T4 is going to be converted into T3. Okay, T4 is going to be converted into T3 where in the tissues with the help of an enzyme called as 5'-deiodinase. So these are the basics. Okay, these are the basics about thyroid hormone biosynthesis. Also, we have discussed a little pharmacological integration, and also we have seen the differences between T3 hormone as well as the T3 as well as T4 hormone. In the next video, we will discuss about what are the effects of the thyroid hormones, okay, on the body. Yes, these are the catabolic hormone, right? Okay, these are the catabolic hormones. These are catabolic hormones. So what are those catabolic actions? We will see in the next video. Hope the video is helpful. Thank you.